One choice. One place. Discovery Health Channel. Real life, medicine, miracles.
We're going to be moving you in a couple minutes, but there's some other things we need to do here, all right?
You got serious injury. We just want to help.
Keep your arms in, Tim. Okay, his heart rate's really, really fast. Any ideas what this is all about, Tom?
San Francisco is a melting pot of every type of diversity, from cultural to sexual to geographical. It's probably one of the most insane cities for the paramedics to work in.
Engine 5 in a vehicle in front of 1405 Eddie, cross the Subway. An unconscious person, respond control to the bound vehicle.
Jeff cuts a path through the city to a man having a seizure on the street. One of his crews is already on scene.
This is approximately 35-year-old guy who started having a seizure. We found him like this.
How long was he in the shelter? Anybody know?
He's been in this condition for 10 minutes. With a very high blood pressure, and right now he's in danger of losing his life.
James Lancaster was beaten up earlier in a street fight. He is now showing signs of a severe brain bleed.
There are many times you arrive on the scene and the patient's taking their last breath or they're losing consciousness as you arrive. So you go to work, get control of the airway, we start ventilating, let's get the patient intubated, we go right through our treatment.
He is struggling to breathe. They clear an airway.
You got that thing inflated yet? One of the key rules of being a paramedic is you never let your heartbeat get faster than the patient's. Slow down, you're doing fine. Because then you don't become effective. There we go, you're in.
His blood pressure is dangerously high.
Keep that tube in place.
His brain is swelling.
That's all you worry about.
Only hours ago, James was talking with friends. Now he is clinging to life.
I like to work as a supervisor as kind of a third pair of hands. Let mission know you're coming ASAP. All right. Let them run their call. I don't interfere with them unless there's going to be a problem. Then I'll intervene and prevent anything from happening. All right, we're all set. All right, off we go. Everybody ready? Yeah. Mission.
We're coming to you with an approximate 35-year-old male. Has been having a seizure for about 15 minutes.
Jeff follows the ambulance to the hospital.
Are we already there? Yeah. That was fast. I'm trying to ventilate him 16 times a minute. He's hyperventilating a little bit.
Hi, welcome to the mission. Do you have a pleasant flight?
The quick run to the hospital may have increased James's chances of surviving.
I need the medical resident and the attendant in floor 1.
Sir.
James Lancaster, the man found seizing in the street, is only getting worse.
We see things that you're not supposed to see as humans. There are just certain things of death and destruction you're just not supposed to see. Initially he was seizing out there, and then he started posturing. And yet we get paid to see it and deal with it.
James had a bleed in his head the size of a baseball. He needs emergency brain surgery.
This guy's doing absolutely poorly. The likelihood of his survival, probably 10%. Once you start doing the posturing, and you've raised your intracranial pressure that high, you're basically got a closed vault with your brain inside. He's bleeding, you build up internal pressure, puts pressure on the brain itself, and then it forces the brainstem, which is your vital organ and control centers, through this foramen magnum. It's called herniation. Survivability is not good for that. And once that herniation takes place, it's very difficult for patients to survive. So we'll have to wait and see with this gentleman.
Bye, Charlie. Bye, Charlie.